Hello, everyone. I'm Michael Lederman. I'm the editor-in-chief of Pathogens and Immunity, and I'm here today with Galit Alter, who is a professor at the Ragon Institute in Massachusetts, and she will be giving a talk at the upcoming Keystone Symposia, viral immunity and respiratory virus infections, and we're here to talk about her work.
Yeah, thanks, Mike. So it was really a pleasure to be invited to this meeting. We've been obviously, I think like the whole world, become very interested in respiratory pathogens, really thinking through what it takes to really fight a pathogen that comes in through the, mucosa and, through the respiratory tract. And really thinking about the differences of immune functions that elicit or exist in those places, right? Where, you think about the upper respiratory tract being kind of a barren wasteland of immune cells, but then when you go deep into the lungs, you have all this like magical circulation that brings in different types of, immune cells to play a part in the battle against pathogens. As you know, my research really begins with this idea that antibodies do more than just bind and block pathogens. And what we really care about is how antibodies act as, molecular beacons that tell innate immune cells and other immune cells to come and recognize that there is something aberrant, within a tissue or in a particular compartment. And then those antibodies then provide instructions on how those antibody opsonized targets can be destroyed. So the presentation that we'll be giving at this particular meeting is really a joint collaboration with Janssen, trying to understand how a vaccine that they've been developing over the last few years against respiratory syncytial virus or RSV, how that vaccine elicits antibodies that do have these magical abilities to really recruit immune functions in and to really tell those immune cells to destroy and clear the virus incredibly effectively. Now, what's really interesting is from work we did with Bali over the pandemic, where he used different adjuvants to try to drive different kinds of immune responses to SARS-CoV-2. We saw that different adjuvants really were shaping these different flavors of antibodies. Right. Yeah, driving these different flavors of antibodies, right? So if you use like a emulsion, something that stimulates probably like these, TLR4-like molecules, you get lots of opsonophagocytic functions. But if you, put in something that triggered TLR7, that's like more viral-like, right, trying to, mimic those nucleic acids, then you would get this highly cytotoxic response. And so, just by tweaking and tuning the kind of pattern recognition you're basically, pushing in the system, that already splits the B cells into these different types of glycosylation profiles that then lead to these different types of immunological functions. Yeah. But there's also this blockade and really leveraging the right immunological functions that we hope to kind of bring to this meeting and get people thinking about this other facet of the humoral immune response that needs to be leveraged to get maximal protection against respiratory pathogens.
It's probably time to wrap up now. This is a wonderful chat with you. I can't wait to see your presentation and hear it at Keystone. And thanks so much for giving us some time.